I'm going to be like the teacher who gets really quiet. Good morning. Welcome to the ribbon cutting ceremony for the new Franklin County Crisis Care Center. Today is such an important milestone for Franklin County. I'm Sally Jeffrey O'Neill, and I'm honored to be here representing my family, the Jeffreys. My sisters Betsy and Ann are with me today. Brother Andy's in New Hampshire. And of course, our amazing parents, Nancy and Tad, many of whom you knew. They're definitely here. They've got the best seats in the house today. Yeah. More than 50 years ago, our mom, Nancy, began advocating for more accessible, community-based mental health services. She long held a vision for a single access point, providing integrated mental health services for individuals and families. She believed with all her heart that when you're experiencing a mental health crisis, the community should not ask you to figure out the system, know which door to knock on, at what time, and with what insurance. Her dream was for a single on-ramp, that's what she called it. One destination where people in crisis could come, be evaluated in a compassionate and respectful setting, and then be connected to the appropriate care. She was instrumental in convening hospital system and public sector leaders to brainstorm and build support for what has ultimately become the Franklin County Crisis Care Center. She continued her work right until her death in November of 2018. Literally, she was telling us to call Amanda and do this and do that the day before she passed. We know that she would be overjoyed to see this vision become this reality. Now I'm going to do this without tears. I am personally very grateful today because I live in active recovery for 25 years for mental health issues and addiction. Yeah. It's been a ride, I'll tell you. But for 25 years, and most especially every day, for me, staying healthy and mostly helping others achieve their recovery is a huge part of my daily life. I had the pleasure of touring the facility a year ago, and I can just say in my lived experience, I've been in and around more than a few facilities. The thoughtful, dignified, compassionate way that this particular facility has been designed is truly out of the realm of reality. It is exceptional, and it's going to make such a positive, hopeful, personal difference to every person who receives care here. I wish we definitely hope other cities are watching, including Boston, where I come from. We don't have one like this. So, on behalf of all my siblings and in memory of our mom and our father, Tad, who was equally committed to the health of the community, the Jeffrey family is truly honored to have been part of the support that enabled this facility to be built, realizing our mother's vision for a single on-ramp where all community resources are connected for maximum benefit. And now, I'd like to introduce our next speaker. She's the chair of the Adam H. Board of Trustees, Donna Zeiderweg.
Thank you so much, Sally, and to the Jeffrey family. We are so grateful to your mother, Nancy Jeffrey, for the pivotal role that she played in this journey to develop the Franklin County Crisis Care Center. Today, with this ribbon-cutting ceremony, we mark an important milestone for community-based behavioral health care in Franklin County. As we look forward to opening the Crisis Care Center later this summer, we also look back, reflecting on a remarkable community that came together to find a new way forward for delivering care with compassion to adults in crisis. As we bring this innovative one-stop crisis center online in the coming months, we bring hope and a path to healing to those most in need in our community. On behalf of the current and former members of the Adam H. Board of Trustees, all of them sitting right here, raise your hands. I want to express our gratitude to all levels of government, as well as the private sector partners whose generous support ensured that this facility became a reality. I also want to acknowledge the incredible work and dedication and leadership of the Adam H. staff and the team at Recovery Innovations and our construction partners, and Recovery Innovations, who's the center's operator. With us today are many of our government partners, and I would like to take this opportunity to ask our elected officials in attendance today to stand and be recognized for your support. Thank you. Now, guiding us through the past 5 years of this incredible endeavor of planning and fundraising and construction has been the Adam H. CEO, Erica Clark Jones, who I would now like to welcome to the stage.
Oh my God. Oh. Thank you, team. Thank you. No, it's not. Please, please, please. Thank you, team. Okay, I wasn't expecting that, but I'm grateful for it. Good morning. Thank you all for being here on this important day. And when I say you all, it's everybody. If you take a look around this room, this is how many people it takes to get this done. First, my heartfelt thanks to Donna and the current and former Adam H. Board of Trustees. Your leadership helped to turn a bold vision into reality, and I am deeply grateful. What stands before us today is more than a building. It is the result of years of collaboration and commitment from leaders across the county, the state of Ohio, and an extraordinary network of community partners. And might I add, an incredible construction team. I see you over there. Together, we believe one thing, that we can and we must do better for individuals and families experiencing mental health and addiction crises. That belief, brought together by advocates, hospital leaders, first responders, behavioral health providers, individuals with lived experience, all united around a shared goal: to create a system that meets people where they are without barriers. We were guided by the understanding that crisis care must be equitable and accessible, regardless of insurance status or an individual's ability to pay. And we build a system with clear intent: compassionate care, 24/7, and a safe and welcoming place. The data told us what all of us already knew. 1 in 5 Franklin County residents will face mental illness this year. Substance use disorder continues to affect thousands. Most mental health crises are still treated in emergency rooms, and the need for services will grow by more than 20% over the next decade. This center, however, is not a standalone solution. It is a part of a comprehensive, community-based crisis continuum, one that ensures there is always, always someone to call, someone to come, and somewhere to go. Since the construction of this project that began On that very mild February morning, we have adopted 988, the behavioral health alternative to 911. Absolutely. Thank you, Leanne. We have also initiated mobile crisis response teams. That's peers and clinicians responding together. And now we have this state-of-the-art crisis center. When fully operational, will serve up to 80 people at one time, linking them to treatment, housing, the justice system, and other vital services. But this is more than a facility. It's a promise to our community that those in crisis will be met with dignity and care and hope. To our many partners, this doesn't feel adequate, but thank you. Your support, whether through policy, philanthropy, or advocacy, that is what made this possible. To our public sector leaders, including former Senator Sherrod Brown, Congresswoman Joyce Beatty, Governor Mike DeWine, the Franklin County Board of Commissioners, Crawley, Boyce, and O'Grady, Mayor Ginther, President Shannon Hardin, and all of Columbus City Council, thank you. To our philanthropic partners, from our hospital systems to the foundations to individual families, your generosity and your vision left an enduring mark on the design and capability of this facility. To the individuals and families with lived experience, and to all of our peers in the RI team, thank you for your honesty, for your courage, for your insistence that we get this right. To our AdamH team, especially our Board of Trustees and our Chief Operating Officer, I'm going to call him my MVP, Jonathan Thomas, who led this project. Thank you for your unwavering commitment. And I must also thank my family for allowing me to miss many soccer games and many dinners at home, but now I'll be around, and it's got to be gluten-free. You should have celebrated while I was away. And finally, we welcome Recovery Innovations and David and your team. And you have a fantastic leadership team, by the way. With your leadership, we will ensure that this space offers not just services, but healing. Together, we are transforming the crisis response in Franklin County. We are offering people what they deserve, which is a place to begin again. Thank you. At this time, it is my honor to introduce my colleague and my partner, Leanne Cornian, Director of the Ohio Department of Mental Health and Addiction Services.
Well, good morning. It is such a pleasure to be here with all of you today to celebrate the ribbon cutting of this unbelievable facility. On behalf of myself, Governor DeWine, the entire team at OhioMOS, I have to congratulate Erica, the entire AdamH team, your board of trustees. Without you today would not have been possible, so kudos. I think it's either unbelievable planning on Erica's part or truly serendipity that today happens during Mental Health Awareness Month. I can think of no better way to celebrate a month dedicated to creating awareness and education and showing that recovery from mental illness is possible and that individuals living with mental illness can truly thrive and live fulfilling lives than this unbelievable, gorgeous building behind us. So today is a shared vision on behalf of the Franklin County Board and Commissioners and Governor DeWine to ensure that every single Ohioan, regardless of their zip code, has access to behavioral health crisis services. We want everyone to know that there is someone to call, someone to respond, and somewhere safe to go when they are experiencing a crisis. Over the past few years, through generous financial investment from the General Assembly, we have been able to do a number of ribbon cuttings, and there are many more to go. I see my friend John Aller in the back, of of crisis centers just like this all across the state. So congratulations, kudos, and it's now my honor to introduce Governor Mike DeWine for some brief recorded messages.
Hello, everyone. I'm Ohio Governor Mike DeWine. Seems like just yesterday that we gathered inside a tent on a chilly February morning in 2023 to break ground on this facility. I recall seeing the artists' renderings and hearing the excitement among those gathered, and thinking to myself that someday this center will be a welcoming place for those who need help. It will be a life-saving beacon of hope for Franklin County residents who are experiencing mental health or substance use crisis. Well, we've flipped many pages on our calendars since that day, but I'm proud to be with you, at least in spirit, for today's celebration, and to proclaim that someday has truly arrived. Someday is, in fact, today. Throughout my time as governor, I've made clear my vision and commitment to completing the behavioral health system that was promised decades ago, yet never fully built. A system where every Ohioan has someone to call, someone to respond, and somewhere safe to go when they need help. From day one, our focus has been on getting Ohioans the support they need to thrive and live up to their full God-given potential. Under the leadership of Director Leanne Cornyn and her dedicated team at the Ohio Department of Mental Health and Addiction Services, we have prioritized making services more visible, more accessible, and more effective. And in doing so, treating individuals and families with the dignity, the respect, and understanding that they deserve. Today is another example of how we are delivering on our pledge to build out Ohio's system of care. The state of Ohio is proud to have contributed $4.5 million towards the overall effort to help transform your vision into reality. This new resource not only will benefit individuals in crisis and their families, but also promises to relieve some of the pressure on overcrowded hospitals and area first responders who are stretched to their limits. I want to thank Franklin County Adam H. Board CEO Erica Clark Jones and her team for their continued leadership and their tireless advocacy on behalf of Franklin County's most vulnerable citizens. I also want to acknowledge and thank the team at RI International, who will provide around-the-clock services here at the center. The work you do to help fellow Ohioans faced with mental illness and addiction challenges is truly heroic and vitally important to the success of this community and to our great state of Ohio. While I can't be with you in person today to celebrate this wonderful occasion, know that I am grateful for your leadership, your advocacy, and your continued support in helping us establish Ohio as a leader in behavioral health advancements and innovation, and in doing so, signaling to the world that Ohio truly is the heart of hope. Congratulations, and thanks to all of you.
We truly are so fortunate to have a governor committed to behavioral health in the way that Mike DeWine is. Speaking of champions, I am now honored to introduce Erica Crawley, President of the Franklin County Board of Commissioners.
Thank you for that introduction. Good morning, everyone. Thank you. I am your Franklin County Commissioner, Erica Crawley, and I bring greetings to you on behalf of the Franklin County Board of Commissioners and my colleagues, John O'Grady and Kevin Boyce, who is here in the audience. Congratulations, Erica, and to the whole Adam H. team for your leadership and for this monumental step. I can't think of a more empowering way to honor Mental Health Awareness Month than by standing here in community to celebrate the opening of the Franklin County Crisis Care Center. Today represents a monumental step, a moment where compassion meets action and our bold commitment to access, equity, and dignity are tangible for every resident every day. As I have openly shared about my own mental health journey, as someone who lives with mental illness and needing safe spaces, I believe the Franklin County Crisis Care Center represents life-saving, community-centered space built with intention, compassion, and collaboration, offering a human-centric support where our residents face their most urgent needs. Overdose deaths are declining in Ohio, and that is something to celebrate. However, suicide deaths are rising, and that cannot be ignored. Because we cannot have a thriving community if our residents don't feel seen, valued, or heard, especially in moments of crisis that leave them vulnerable and at risk. Years ago, when we developed the Rise Together Poverty Blueprint Plan, our residents, my neighbors, spoke up. They asked for better access to jobs, housing, youth opportunity, and most importantly, access to health. And we listened. Franklin County Board of Commissioners committed $15 million in partnership, purpose, and people first planning. This is inclusive, transformative infrastructure backed by Franklin County, the City of Columbus, the State of Ohio, major hospital systems, and philanthropic partners. Together, this more than $60 million investment says clearly, we believe in your recovery and we believe in your potential. When we create safe spaces like this, we don't just respond to crisis, we change the trajectory of lives. This facility reflects our no wrong door approach. If you are in crisis, you are not turned away, you are met with compassion and care and connection. When residents and families have access to care, it means a mother facing postpartum depression doesn't have to navigate her struggles alone. With access to compassionate care, she can receive the support she needs, ensuring both her well-being and her baby's. It means individuals experiencing homelessness have a place to turn during a mental health crisis. This facility offers 24/7 walk-in services, providing immediate person-centered care with no appointment or referral required. This approach meets people where they are in their moment of greatest need, offering compassionate crisis care without judgment and reducing the strain on emergency departments. Today marks more than a ribbon cutting. It marks the beginning of a stronger, more compassionate, and more resilient Franklin County. One where every person has access to the care they need, one where every person, every individual can thrive and not just survive. One where care and compassion is standard, not the exception. To the Adam H. Board and to its leadership, thank you again for your vision and your unwavering commitment to the well-being of our residents. And now, it is my pleasure to welcome Elon Sims, representing the Mayor's Office. Thank you.
Well, good morning, everyone. Well, it's almost like a full circle moment for me. I started my career right across the street at Children's Services, and so as a social worker, now moonlighting as a chief of staff, I know really firsthand the families and the children and individuals impacted by mental health and addiction crisis in our community. So it's an honor to be here today to see this beautiful facility come to a fruition. So thank you, Erica, and all the various partners who have come together to do this work. As you all know, every one of us has experienced personally and been touched by the crisis happening here in Central Ohio. 21% of this county's residents will experience mental health illness in a given year. 10% will abuse or be dependent upon drugs or alcohol. 300,000 mental health crisis episodes are treated in this county annually, mostly in hospital emergency departments. With this growing region, we will see, as I already mentioned, over 20% increase in the need for mental health and addiction services over the next 10 years. The City of Columbus is proud to have given $10 million towards the construction of this new center that will benefit everyone, from individuals in crisis and their families, to the overcrowded hospitals, even to our first responders currently stretched to their limits responding to these types of calls for service. So much has already been said, but thank you. Thank you to our partners who are helping to provide a pathway to health and healing for Franklin County's residents. We are proud and thankful for this vision becoming a reality. As my friend Tanny Cran would say, this is a true stacking of hands. So thank you all for this great work we are getting ready to do in this community. And it is now my honor and pleasure to introduce the Honorable Council President Shannon Hardin.
Good morning. Oh, we can do better than that. Good morning, Columbus. It is an honor to be here on behalf of my colleagues on Columbus City Council. I saw Councilmember Rosa De Padilla. Would you stand to be recognized? As well as Councilmember Melissa Green. I also have to recognize, we lent her to the county, our county prosecutor, Shayla Faber, but who was a strong advocate and supporter and voted to support this when she was on council. We join you to say congratulations, Erica. We are so proud of your leadership. We are so proud of your team that got us here today. Thank you to all the partners, the community partners, as Elon said, our chief, who have stacked hands to provide this critical service to our community, from Recovery Innovations to Ohio Health, to the folks at Elford who built this beautiful center. We say thank you. I often say that what we build, the bricks and the mortar, are just physical manifestations of a community's values. And if that is true, that the thing that we will leave behind after we are in these positions and after we are long gone are our current values, what does that say about us as a community right now? It says that we value recovery. It says that we value folks in need. We say that we value dignity in how we support one another. And so we're really grateful that this is today more representation of our values in action. It's also, though, building on our city's vision of creating an alternative crisis response system, building on the foundation laid by the REACT system, SPARK, and the RRU. I see our police chief, Elaine Bryant, here. Would you stand to be recognized? And our fire chief. Again, this is all of us coming together, stacking hands to make sure that when folks are in crises, they have an appropriate place to go. Together, we are creating not only a safer Columbus, but a more just and compassionate Columbus. So thank you again to everyone for all the amazing work you've done, bringing this project to fruition. Now it is my honor to introduce my friend, our leader of our board, and leader and the board chair of Central Ohio Hospital Council, Mr. Steve Markovich.
Good morning. Thank you, Council President Hardin. I'm Steve Markovich. My day job, I'm the president and CEO of Ohio Health, but today I'm representing the Central Ohio Hospital Council, which is not a big group. It is the 4 CEOs of the Franklin County hospitals. We get together regularly to work on the problems as a community that we face. And the 3 adult systems, Ohio Health, Mount Carmel, and OSU Wexner, we are proud to be part of the solution to a big problem for our community. We understand the need for this type of facility in our community, and that's why we were proud to help provide some of the seed money that got this going. Let me take you back to put a little bit of a scope to this. Go back about 15 years to 2009. We, as hospitals, admitted about 400 patients a month for inpatient crisis psychiatric care. 3 years later, that number doubled. 3 years later, that number doubled. 3 years later, that number doubled. So that by 2015 to 2018 or so, from our perspective, it was in crisis. It's clear that we needed a better system of care. Emergency departments are not great places for psychiatric crisis. They're busy, they're bright, they're loud, they're chaotic. They are not the best environment for residents that are experiencing a mental health crisis. And we know that 80% of Franklin County's residents seek care for their mental health crisis. Their first stop is one of our institutional ERs. So way back in 2015, the hospitals reached out to the Adam H. Board, the Ohio Department of Mental Health and Addiction Services, the Columbus Foundation, and a lot of other folks to say, we got to find a better solution here. And that year, more than 30 community health-centric organizations came together to find a better way to meet mental health needs for our residents. And over the next year, they listened to each other, we learned, we thought about what could be, and the concept for a comprehensive crisis center really came to be that would serve all Franklin County's residents. Our hospital systems are confident. The leadership of our hospitals are confident and trust that this facility will improve the health and well-being of Franklin County's residents. It's going to provide our residents a new level of care, a level of care that frankly is missing from what we could traditionally provide when you think about the crisis continuum. Mobile response, patient observation, emergency care, inpatient treatment, The best service that we can provide to our community is by creating a collective focus on meeting the mental health care needs of our residents. In our Central Ohio hospitals, we will continue to do our share and collaborate in the months and years ahead, not only with the Crisis Center, but with everyone that touches the lives of those in crisis. We are proud to fulfill that role. So on behalf of the hospitals, I want to express our appreciation to the Adam H. Board and our partners across city and county government for your leadership and commitment. So thank you for the opportunity to speak today. I'm going to turn it over to another great partner, Terry Donlin-Huseman, President and CEO of the Osteopathic Heritage Foundation.
Thank you, Dr. Markovich, for that introduction and all that the healthcare systems do in Franklin County. Good morning. Again, I'm Terry Donlin-Huseman. I have the privilege of serving as the president and CEO for the Osteopathic Heritage Foundation, and it is certainly an honor to be here today to celebrate this transformational moment for our community and individuals and families experiencing a mental health crisis. This center represents, as Erica said, more than just a building. It's a profound investment in the health, dignity, and future of how this community cares for those in need. The Osteopathic Heritage Foundation recognizes the importance of mental health to one's overall health and well-being, and as such, we prioritized early engagement and support for a new approach to the provision of crisis services, while at the same time elevating philanthropy's role to support this new, innovative, forward-looking approach. Support for the Crisis Center advances the Foundation's mission, which is to improve the health and quality of life in the community through education, research, and service consistent with our osteopathic heritage. This heritage emphasizes care for the whole person and an understanding that well-being is shaped not just by medical treatment, but by timely support, accessible services, and expert mental health care. This crisis center embodies those values. The Foundation is proud to join our philanthropic colleagues, private and corporate funders, alongside the hospital systems, local and state government. This collaboration is a powerful reminder of what's possible when public and private sectors work together to address pressing community needs. The momentum behind this building reflects a shared recognition that mental health and crisis services are central to a healthy, thriving community. I'd like to acknowledge and thank the Osteopathic Heritage Foundation Board of Directors for their significant early support that helped make this crisis center a reality, including 3 directors that are with us today, Dr. Jeff Hutchison, Dr. Becky DeVillers, and Dr. George Fairber. Thank you for being here. To Erica Clark-Jones, your incredible team, and the Adam H. Board, thank you for your leadership and commitment to reimagining how crisis care services are delivered in Franklin County. In the coming months and years, the Osteopathic Heritage Foundation looks forward to the much-needed care and services that this center will provide and the impact it will have on the health and well-being of community residents, especially the most vulnerable. Thank you for the opportunity to be here today, and it's my distinct pleasure to introduce David Covington, the CEO for Recovery Innovations, the operator of this important center. Thank you.
A crisis has no schedule. Erica and the Adam H. leadership, the Jeffrey family, Ohio leaders and partners, you're fulfilling the promise of 988 with this safe place for help. We at Team Recovery Innovations, we are so honored to be joining this incredible community in Franklin County. At Recovery Innovations, we believe that a crisis is not the end. It's rather the pivotal moment where compassion, connection, and care can change everything. That's what drew us here. The shared belief that people in crisis deserve dignity, respect, and real help right when they need it. What makes our approach different? From the very first moment someone will walk through these doors, they're not treated like a diagnosis. They're treated and called a guest, with peers who've lived through a crisis themselves, with nurses, counselors, and doctors all working side by side, with families embraced, not left in the dark during the crisis. And for our first responders, for our police, our fire, our EMS, this center is a game changer. No more waiting for hours in an emergency room for medical clearance. Officers and medics will drop someone off directly right around the corner here, often in under 10 minutes, and get back to doing what they do, to public safety. The person in need gets care right away. Everyone wins. Franklin County isn't just keeping up, it's leading. This center is a national model for what crisis care should be in this new era of 988. And we can't wait to showcase it again during our live Crisis Jam broadcast on June the 4th. But ultimately, this isn't about buildings or systems, as it's been said. It's about people. It's about lives changed. It's about stories rewritten. And to bring that human story to life, I'm honored to introduce someone doing that, just that every day, Jennifer Johnson, Intensive Outpatient Coordinator with Mary Haven. Jennifer?
Thank you. I want to thank Adam H., first of all, for inviting me here today to represent the many talented, dedicated colleagues that I get to work with every day. And we get to serve a very special population of people. The services that are going to be offered here at the Franklin County Crisis Center I know firsthand, and they can be life-changing. Not only from a professional view as a Mary Haven counselor, but from a personal view as someone who has likewise walked the road of recovery. 23 years ago, I walked through the doors of Mary Haven and I asked for help. I was welcomed, not judged. That's what's going to happen here. Then for the next 2 years, I spent with several Adam H. Providers. And you know the miracle of miracles? I never got a bill. Tell me when that happens now. Rarely, rarely. The new Crisis Center stands as a lighthouse for anyone who has ever felt lost, isolated, or overwhelmed. It sends a powerful message. You're not alone, your pain is real, and help is here, without judgment and without delay. Timing is everything. When in crisis, somebody I think just mentioned it, when a crisis occurs, opportunities emerge. And removing the barrier of accessibility is game-changing. Thank you to all the visionaries, many of whom are here today, and the journeys of those individuals and families I now support every day. I know how much relief comes when a place like this, it takes the support of a community, friends, neighbors, and family. Many of our clients have lost that connection with community and family. I'm going to quote a gentleman, his name is Johann Hari, and he's a British author and journalist. And he says, I quote, "The opposite of addiction is connection." I get that today. I get that today. I was blessed to have the support of my family. I was blessed to have the support of my daughter, Kara, who, Sally, I'm going to tear up like you almost did. Kara's here with me today. And without her support and understanding I would not be standing here today. She supported me then, and she supports me now. And I'm proud to say that she's actually an HR director at Action for Children, another nonprofit. So kudos to Kara. There you are, embarrassed. Okay. That's what mothers are supposed to do, aren't they? Yeah, you got it. So with that, today a new door opens. For every person in crisis, for every worried parent or partner, for every neighbor trying to hold on, a new place of hope. And it starts here. Thank you. And I told Mr. Thomas I was going to say this last but not least, Jonathan Thomas, COO for Adam H.
That's unnecessary. Good morning again to everybody. I've been told I have a few allotted minutes here. I'll try not to go over. For those of you who know me, I do actually have some written remarks, and that's mainly because I'm going to use the time I have as a spokesperson to talk about all the people I stand up here representing, because the work that we're celebrating today came from many, and you've heard a lot of them acknowledged throughout the day today. I'm going to start with acknowledging our board of trustees, their volunteer trustees, as well as our CEO, Erica Clark-Jones, not only for their leadership in keeping this project at the forefront through the last several years, but doing it during unprecedented times that it included, amongst other things, a global pandemic. I also want to thank the community that we're sitting in or standing in right now, Franklinton. This neighborhood, from the West Edge Association to the Franklinton Board of Trade and the Franklinton Area Commissioners, have been not only advocates in supporting this project, but they've literally welcomed the Franklin County Crisis Care Center into their backyards. And that's not something a lot of communities have going for them. Yeah, give it up for Franklinton. Next, I'm gonna ask some individuals and organizations, as I name them, to please stand. So we have a little audience participation here to make sure they're recognized. And even though I know you're gonna have to fight those feelings, you're gonna wanna cheer and clap for them. Let's wait till the end, and then we'll acknowledge them all at once. First, we're gonna start with, how does a building like this get designed? Well, you have an amazing design team led by NBBJ, Architecture Plus, Corda, and IMEG from the architecture and engineering standpoint. I know you all here, start standing up. Stay standing. We also have our construction management team, many of whom are already standing, but if you're not, please join your colleagues. That's been led by a strategic partnership with CK and Elford. We've also had support from all of our Franklin County sister agencies, starting first and foremost with Franklin County Public Facilities Management, Director Darla Reardon and her team, who have helped guide Adam H through this process. Adam H does a lot of things. Building buildings isn't one of them. And yet we're standing in front of a very impressive building. We also have Franklin County Purchasing, the Office of Diversity, Equity, and Inclusion, the Franklin County Data Center, the Prosecuting Attorney's Office, with special acknowledgments for Janine Humber and Jesse Armstrong, because all of this work takes a lot of complex contracts. Again, things Adam H doesn't normally do. We had an owner's representative led by Hammes Company Healthcare, with our prime representative being Dwight Young, who also brought to the Hammes team to help us through this project, Ginger Cunningham and Sean Greer. The collective efforts of those individuals on the county and owner's rep side helped ensure that over 30% of the contracts that built this $60 million facility went to small and emerging businesses in our community. The last few individuals that I'll try to embarrass are individuals who not only had direct impacts and roles on what you're getting ready to walk through here in a moment, but also offered me invaluable supports in my role as project lead. That includes the Central Ohio Hospital Council's president and CEO, Mr. Jeff Klingler, Annie Gallagher, Carrie Mullard, Mark Hunter, and Meg Griffin. So please join me now in thanking these partners for what they have done, but specifically how they have done it. You all can sit now if you want. The last moment of crowd participation I'm going to do is to further illustrate what I think you've all been seeing and hopefully feeling throughout this program today. So everyone I just named, you don't have to stand again, but I'm going to ask you all to raise your hands, and then anybody here who also participated, themselves or their organization, in the Psychiatric Crisis Emergency System Task Force, in the Crisis Care Center Steering Committee, or in the Crisis Care Community Advisory Council, will all of you please raise your hands? Oh, some of you didn't listen, because I see more of you. Hopefully what you see by those who have stood and those who have raised their hands is that this has taken a community. So again, as a spokesperson, I get to stand here. One thing I've learned from this project is doing something for the community is what all of our organizations believe in. But to really accomplish what you're getting ready to walk through, you have to do it with the community. And I think our program today shows that that's the approach that the Adam H. Board has taken. So with that, I'm going to say you're getting ready to walk into your Franklin County Crisis Care Center. I've been told that I'm supposed to ask the rest of the speakers to please join me out front to literally cut the ribbon. And then after that, we're gonna have waves of individual tour our first floor. You'll go in about groups of 20. And without further ado, I'll just say thank you all for your time and attention this morning, and let's cut the ribbon.
Good idea.
I wouldn't hold on that though, because it's making the hand there. We can just end it flat, so don't hold on that because it's making it up. Yeah, here.
Yeah.
Well, if you make, it's either 2 legs of the squirting or 1 leg.
Well, we can spread out and let's do 2 lanes. We'll go through 2. That way we don't have to crowd. Yeah, let's do this. We got this. We got this. Yeah.
We're cutting the ribbon.
They're right in front of our face. We all get to take a prize. Nice. You had these in your stash?
We're a little cramped, so everyone's just going to take 1 step.
1 step?
We're a little cramped.
1 step? Everybody step?
Step. Okay, is that good, Ian?
Joy.
We're doing it.
Joy.
Okay, everyone ready?
Oh,
3,
1,
2, 1.
right now.